Salam and peace. You're watching Muslim Network TV on Galaxy 19 satellite, Apple TV, Amazon Fire TV, Roku, and many other places, but including our own website, muslimnetwork.tv. And we're 24/7. This is the only American Muslim television network in North America, reaching throughout Canada, throughout USA, as well as Mexico. Today is the first time that two of my own staff has called in sick because of the fear of COVID. One is tested positive already, and the another one is on his way, and he was my own producer, to be tested. And so it reaching our family of our team of Muslim Network TV. And people are sometimes surprised. I mean, the one of our team member who has tested positive, and now his wife tested positive, he was required to work from his office. And he was there for 3 weeks. Each time he was tested, whether he has fever or not. And then he has a separate cubicle away from others. And he was required to have mask all the time he was there. The day he quit the job is the day he started having symptoms and tested positive and will not be able to work on his new job. And today was his joining date. What's happening? Are we relaxing? Are we making some small mistakes here and there? How are we getting this thing while following all the directions which are required of us to follow? Are all of us getting into the routine? And sometime in routine, you forget about smaller things. Sometimes social distancing, washing hand often. And in the meantime, some people's frustration is getting to a very high level. Demonstrations are taking place throughout the world, and yesterday in London, where tens of thousands of people, I don't know how many are there in count, but the crowd image looks huge. And they're against lockdown, against vaccination, against mask, and they're against almost everything. And I personally feel I'm letting my guards down also, while people are worried about the second wave. To talk all about these things, so we will have two persons who are going to help us. None of them is a physician. Everybody is talking about it, but both of them are well-informed people helping in one way or the other. One is Professor Gabriel Wainer. Welcome to Muslim Network TV. Professor Gabriel Wainer is a professor of Department of Systems and Computer Engineering at Carleton University. And we will also have from London, Damien Gayle. Welcome to Muslim Network TV, Damien. Damien Gayle is a reporter at the Guardian newspaper in London, UK, the only international paper I subscribe by paying for it. So I like it. I like their design also in print. So I have a lot of conversation. I know both of you cannot claim to be an authority on an expert on this thing, but you're observing politics of it and science of it and reporting about that. And this is what we like to discuss that. Are we already in second wave? Are we waiting for it? And feel free to jump in and crisscross each other, ask each other a question if you have one.
So if you wish, I can get started.
Countries here, Canada.
Yes, so
USA.
I can get started if you wish, Malik. Thank you for having us. Thank you for the invitation. So yes, I'm not a physician, but I've been doing models of COVID since March. And I've been reading most of the literature. We have 3 projects related to COVID modeling. And yes, we are in the second wave. All of the experts, at least I'm going to talk about Ontario and Ottawa, where I live. Worldwide, we have to analyze each country separately. There are certain places that didn't even finish their first wave yet. But the curves are absolutely clear here in Ontario. The computation of the models that determine if you're in a second wave, they all say we are already in a second wave. Today, we are at levels that are even higher than April in most of Ontario and Ottawa. And it's we need to get ready because the winter is coming and it's going to get worse.
So, so winter and summer difference. We'll talk about that also. Tell me, how is in UK? Are they thinking they're already in second wave?
So yeah, in the UK, the narrative coming from the government is that we are heading into a second wave now. We've seen the numbers of cases surge. On Friday, there were 6,000 new cases here. Today, there were 4,000. But the death toll is yet to reach the levels that we saw back in March and around that time, April and May, when we had over 1,000 people a day dying of COVID-19. So I think at the moment, although there is this huge increase in the number of cases, there's a slight sense of disbelief that we are actually entering a second wave. And there's a lot of skepticism around people who have become slightly weary of the restrictions that have been put in place by the government.
Slightly weary, is that a traditional British understatement? Or really only few are concerned about that?
Pardon?
I mean, is the people being weary, is it a very common phenomena there, or is it really a small group of people who is jumping up and down about that?
I think when you speak to normal people out on the street, generally there's people were very afraid at the beginning of the pandemic. Everyone was doing their best to obey the instructions that were given to us by the government. We all were afraid that this was going to be a devastating pandemic. It could kill up to 2 or 3% of the people who were infected. And it doesn't seem to have panned out quite as bad as people were expecting it to look. So I think whilst there is some widespread kind of tiredness over the rules, I mean, there is still broadly speaking, people are still on board with what the government's message is, but there is a growing protest movement.
Okay, so you know, in the United States, there are more than 200,000 people have died. And in politics, unfortunately, not many people have been mentioned. I mean, this is way more than the First World War. And there is not much of mourning, unfortunately. It seems to be accepted as a sort of acceptable thing. I don't know how it is possible. Why people are expecting, so the data is telling you that it is second wave has begun. I mean, in US, there is a New York Times publishes a chart of the graph is going up and down. After almost a month and a half of graph going down, it has started climbing again on their 14-day average. You mentioned that, you know, winter, as winter approaches, it is going to be more lethal.
Mm-hmm.
And some people were talking, well, summer is going to disappear because summer is a hot. So have people established a correlation with the temperature for this thing?
So there's a few topics here. I'm going to elaborate on some of the things that Damien mentioned 2 seconds ago, but there's a few important things that we have to consider. Number one, there is a well-known phenomenon related to this tiredness, which is called lockdown fatigue. We knew it was coming. But that is also combined with very basic psychological behavior that all humans have, which is negation. So we have been reading a couple of articles on how the negation mechanism act on this pandemic situation. Some people do not believe it's happening, and they go out and they live their lives as normal. This is going to affect seriously what's coming, and we have seen this exact behavior in previous pandemics. And what's happening in the UK with people going in the streets and complaining and relaxing, it's exacerbated because there are not as many people dying, as Damien says, and the hospitals are not being crowded. So people tend to relax, but the reality is that the numbers will follow. This is not immediate. So if you see the curves, the numbers will go up, and eventually this is a communicable disease. It's person to person. So you will get to infect other people that will infect other people. This is exponential, and there is no way in which this will stop. We've been lucky that in the last couple of months, during the summer, it has been driven in Ontario in particular by younger people who have less probability of dying and less probability of having serious symptoms. So then the hospitals are doing decently, but this will change. It started to change. It started affecting older populations. But one thing that nobody's talking about that is extremely serious, and the young people should understand, is that there are no seriously reported side effects and long-term effects. This is major. Recent studies show that 20% of the people that got COVID-19, they might up having heart problems for life. So it's 20. So you're not going to die in the ICU tomorrow, but you're going to have a heart attack in 15 years if you're 40 and you go out and you get the disease because of being too relaxed. So there's clear results on heart disease. There's kidney disease. There's lung problems. In some people with the disease, when they have very important symptoms, it seems to last 6-8 months, and the people still have symptoms, and it takes forever to go away. People still have fatigue and breathing problems. So we have to be aware that yes, you might not die now, but you're creating a long-term problem to your own body, because this disease is not a respiratory disease, it's a blood disease, and it goes everywhere. So we have to be aware of that. And these negation mechanisms that we have don't help. So it's really tough, because we've been for months locked down and following the instructions, and it's so easy to let the guard down, right? So now we have to be stronger. And the issue of the winter is not related to temperature and the virus. I can talk about that later if you want, but it's related to the mechanism of spreading of the disease. It's all indoor, and what are called super spreader events. We will go inside, and that's not good news.
So one of the points which you just mentioned, it's not, it is a blood disease. Is it, has it been seen in a British newspaper as it is a blood-related disease and it's not respiratory issue? I mean, this seems to be a very unique angle which Professor is bringing into the conversation.
No, I mean, the messaging that we have, generally speaking, towards young people is that whilst the disease may not affect you badly, you could pass it on to someone else who it may affect badly. And I think that's probably contributed somewhat to the sense of invincibility that some young people have. They think as long as they don't go and see grandpa, then everything's going to be okay.
Yeah, all the grandpas is being isolated. Everybody is protecting them. substantially. As a grandpa, I understand the war on grandpas essentially at this moment. It seems like, and younger people thinking they can do whatever they want. But I do want to talk about this thing when we take a short break. I want to dwell on this thing that why people, this summer thing, a lot of scientists were even talking about, well, summer is going to help. But now summer is gone. My garden is dead, and at night it is already 40, 50 degrees. You're watching Muslim Network TV, and we're discussing about the second wave of the pandemic. We'll be right back after these messages.
My wife, she's a professor at the University of Cincinnati, who's Catholic, and by her watching and listening to our 3-year-old son watch Adam's World, she ended up taking Kalima Shahada. She embraced Islam because she learned so much about Islam and the other prophets. It really affected our life in a great way, and because of Sound Vision and Adam's World, we're Muslims.
I took my Shahada 15 years ago, and I actually am from a rural part of Ohio. And so I found the catalog for Sound Vision, and I ordered the tapes and the CDs and the books, and I used those, and especially for my little daughter, that's how we basically learned our Islam, and Islam entered our hearts through the wonderful works of Sound Vision.
Okay, assalamu alaikum, brother. I just want you to know that I love the Sound Vision website, that a lot of times when I'm looking for information, especially as it relates to homelessness, domestic violence, and women issues, I go to that website, and then I see what you've written, and then I copy and paste it and spread the word, because the wisdom is there, so I can't do any better than what Sound Vision has already done.
Sound Vision is our survival guide. It is the organization that provides skills for Muslims how to survive and thrive in this community here in the U.S.
Assalamu alaikum, my name is Anam, I'm in 11th grade, and I grew up with Adam's World, and what it taught me was unity, respect, and love for the Muslim Ummah.
Adam's World is the greatest show ever made. Take me to the Kaaba, man. I love that puppet.
Welcome back to Muslim Network TV. This is Imam Malik Mujahid, and we're talking with Professor Gabriel Wainer and Damien Gayle. So the weather. So why are we expecting winter is going to be worse for the pandemic?
So there's a major component on this, which is that recent research has shown that the disease, so it's transmitted through your respiratory tract. So you will get it through your mouth, nose, it goes to your lungs quickly, and it spreads out throughout your body. And what happens is that when we go indoors, there are several ways of transmission. And it seems very clear that what are called aerosols are a major component of the transmission of the disease. Aerosols are tiny, tiny particles that float in the air. So the 2 meters distance is very important. But what it seems that the research has shown very recently is that if you're locked in a room with poor ventilation, just breathing out, if you have the disease, you can get someone else sick. And the problem is that building models for this kind of behavior is extremely complicated, because every person sheds a different amount of virus. So some people just will sit down and breathe in a room and they can get you sick. But it's known that if you speak, the probability of getting someone sick, if you are sick, is higher. It's worse if you scream or shout, and it's worse if you sing. So you shed a large amount of virus through your voice. And if you're locked in a room and you don't wear a mask and there's poor ventilation, the probability of contagion is 20 times higher than outside. So what's good about the summer? We've been outside all the time. So the probability of getting sick if you're doing outdoor activities is not that big. The sun helps killing the virus. The air flow makes it go away from your body quickly. So if you're having a dinner in an outdoor patio, the probability of getting sick is not that big. As soon as you go indoor, it will get worse. So in the northern part of the continent, we're going to go into our homes, and there is a pattern of contagion that seems that people get sick by their own families and their close friends. Who are you going to bring home? Your family and your close friends. So this is what the winter is going to bring into the equation. There is no evidence that the temperature has done anything to the virus. So this is what we have to be worried about. Reduce the number of contacts, see who you bring home, and you need to try to do some proper ventilation in your homes. And you need to get your office properly ventilated too.
So the places where city like London and places where there are always those houses and apartments and what they call flats at the top of each other, and there is a one air circulation system. So there may be more vulnerabilities most likely in those places. Is the city of London concerned about how the air is circulated, heat and air is circulated in those buildings?
Well, I think in terms of office buildings, just a couple of weeks ago, the government were trying to encourage everyone to get back to work. And they wanted everyone to go back to the office. And it was seen as our patriotic duty, not just to go back to work, but to get out to the pub, to go to restaurants. The Chancellor of the Exchequer ran a scheme giving people half price in restaurants, a benefit paid for by the government, which saw restaurants and pubs and all kinds of establishments up and down the country packed with people. And this was at the pandemic's lowest ebb over the summer. So it's very much mixed messaging. And I think this has confused a lot of people in this country, because a few months prior to that, we were all being told not to leave our homes. And if we did, it was only an hour a day and for exercise only. And then towards June, July, they were very keen, having seen the disastrous economic consequences of the lockdown. And in the UK, the government actually paid the wages of millions and millions of workers under its furlough scheme to ensure that they weren't laid off by businesses and to ensure that businesses didn't go under. So they very much wanted to restart the economy and switch the advice from being everyone must stay apart and everyone must stay in their homes to everyone get out and spend money, start getting back on public transport, get back into the office. And then we've seen case numbers going up. But this sudden switch and then a switch back seems to have fueled the skepticism that some people have about the way, about what the government has been telling us about the virus. I mean, one notable switch, which a lot of people have picked up on, has been that initially, the advice coming from the government's medical advisors was not to wear a face mask because it was considered to actually be a vector of infection. And it were normal people without medical training were considered not to have the wherewithal to use a face mask properly enough to prevent themselves from becoming infected by leaving the face mask lying around, picking it up with dirty hands, getting it covered in germs, taking it off and putting it back on again. And now they're telling everyone to wear face masks when you walk into a shop, when you take public transport, and you do see everybody wearing these face masks. Most of them homemade, most of them just made of cloth, which are not being disinfected by people because there is no advice saying about the safe usage of face masks other than just to say wear them. And I mean, one of the things that I encountered at the large lockdown protest that we had on Saturday in London was that this was an issue that was brought up again and again by people on the protest. They were saying they're telling us to wear these masks, and they call them muzzles. They regard it as an attempt to muzzle them. But they're saying they're telling us to wear these masks, but actually the virus is smaller than the mesh on a cloth mask, and it will just pass in and out absolutely freely, as it were. And I do wonder, Gabriel, what you would say and what your kind of expert view is on that, on the use of cloth masks as opposed to proper surgical masks.
Mm-hmm. So we've been vouching for masks, I would say, since February. So what happens is that the SARS CoV-2 virus is pretty similar to the SARS that we had in the small pandemic a few years ago. And for SARS, there were studies done with masks, and they showed that even the simplest of the masks would reduce the amount of viruses sent out. So they filter. So number one, they filter some amount of virus, even though they are small. They filter them out. But something that you have to think about, which is probably more important than the amount of virus that is filtered by the mask, is that the airflow, it's absolutely different when you don't have a mask. It goes straight to your friend that you're talking to. If you put something over here, the computational fluid dynamics shows, and the studies that validate that the air flows in a completely different direction. And then the probability of you getting infected someone is way lower. And in Ontario, there are studies that appeared a couple of days ago that proved that the amount of cases that were prevented because of the use of masks was approximately 25% less cases just by the using of the masks. In February, March, there were a few contradictory messages about masks, mostly because the studies were done better later. So there has been a lot of studies done about masks, and then there was a lack of the high quality mask for the first responders and for the people that are in the front lines. So if you don't have surgical masks for nurses and doctors, you're not going to go and tell people go and buy a mask, because they will go to an online site and will buy them to use them at home. And then at that time, there were not enough masks for the people that need to take care of us. So there were a couple of mixed messages, but eventually that message changed completely, and it's known that you have to wear a mask. It's going to help you. So we ran different simulations. So in my lab, what we do is we study real world situations using a computer. So we can do crazy things in the computer because we can make people get sick, and it's a simulated disease, so nobody's going to die. So we can explore different scenarios. All of the scenarios about all kinds of masks, they improve the amount of the people that will not get sick very seriously. We also have included these behaviors that we see. People disobey at this time because of these negation mechanisms and because of human behavior. People are tired of being locked down and all of this situation, and it's normal and it has happened before. So what we did is we simulated what happened if people disobey the government, and the numbers of people disobeying the government versus not having any preventative measures, it's more or less the same. So what will happen is that you will see that if you don't use any containment measures versus there are containment measures, but nobody pays attention to those, you don't gain that much. We need to do our part. It's extremely complicated because people are tired. But right now, the main thing is to follow public health instructions. You have to wear a mask. You have to keep your distance. You have to ventilate your rooms. And you have to keep your bubble small. You don't have to keep people, you don't have to, it's not a good moment to contact people outside your close friends. The larger number of people that you get in touch with, the larger the probability of get someone sick. And keep in mind that these people will not die because they are 30 years old and they will survive. It's a cold, but they will die 10 years from now from heart disease because it will affect their heart. Yes, sorry.
So you see, but that's where we lost the trust on the government. Initially here also, first they say I have the mask, if I remember correctly. Then they realize that this mask, they'll be run on it just like a toilet paper. So they say, well, no, you don't need it, this thing, and it is needed. If they were upfront that right now, healthcare workers need this, so please don't buy that, or buy beforehand for healthcare workers. So that confusion sort of, the world, a whole lot of us, including me, have a skepticism about politicians deciding for ourselves because we don't consider them to be motivated. They're motivated by multiple variables. So skepticism of politicians is I think is a sort of healthy thing in our society. Gallup USA surveys politicians and other institutions, other professions. The professions who come the lowest in among the top 10 professions are politicians and congressperson. And I do not have a good news domain for you. Media also comes at the lowest level. So people are skeptic. And when they gave a very clearly dual messages about mask or no mask, and later on explain, well, initially we thought this. I understand what Professor Wainer is saying, that the science says that now when you have that mask which you made up, it interrupts the speed and the straightforwardness and the flow. And since that, although the virus is 1,000th of our hair, but it resides on water which is coming out of our mouth, which could be prevented through that. And that information is now being available. But I like to take a short break, and when we come back, I like to dwell on this, why people think the second wave is going to be more lethal. While we're all putting our guards down, scientists are saying second wave is going to be more dangerous. You're watching Muslim Network TV, and I'm talking with two informed people, Professor Gabriel Wainer and Damien Gayle, and from Guardian London. So it's international conversation. We're in US, and Professor is in Canada, so is our producer, and we have a view from London by Damien Gayle. We'll be right back after these messages.
what was it like when you started this network out, when you started Sound Vision those many years ago?
After 9/11, one lady called me and she says, what is your channel which I can watch? And I say, I'm sorry, we don't have a channel. And you know what she said? She said, then how America will know about you?
SubhanAllah. Anything you want to say to the people who are watching? We had one sister who messaged that she grew up on Sound Vision. What do you say to the people who have been long supporters?
Thank you. Thank you. It is because of you we are able to do all of that. So the generation of Adam's World, you need to take it over for the next generation. And that's my invitation to you. So keep telling everybody where to watch. They can watch it on Galaxy 19 satellite, Amazon Fire TV, Apple TV, or easy thing, muslimnetwork.tv, or our YouTube channel, or our Facebook channel. And with your help, inshallah, ladies, the one who called me, what channel should I watch Muslims on? Answer is here and now.
Open up your eyes. Assalamu alaikum everyone, it's your brother Zain Bika from South Africa. One of the first educational programs ever produced for Muslim children was the ever popular Adam's World series. The colorful and comical Muslim puppets stole the heart of a generation. Sound Vision will be releasing brand new episodes of Adam's World with the launch of a Adam's World app. Subscribers will enjoy new Adam's World episodes as they are released, as well as all the classic episodes of Adam's World. So visit adamsworldapp.com now to learn more, subscribe and enjoy new adventures of Adam and his friends. And let's keep helping tomorrow's Muslims today. Assalamu alaikum.
Adam's World. Believe me, there's a lot to see. Bismillah, let's explore.
Welcome back to Muslim Network TV. You're watching Galaxy 19 satellite, Apple TV, Roku, Amazon Fire TV, and our own website, muslimnetwork.tv. Tell us why, Professor, people are saying that the second wave, which is there, is going to be more lethal.
The reality is that nobody knows, but historically it's been like that. Before we get into this, I would like to comment on your last issue about the trust on the government, which is probably going to help, in making the second wave, harder than the first one. But the one thing that is extremely difficult to convey for any government is that this is a new disease that nobody knows anything about. And on one side, governments, the World Health Organization, the local, CDC in the US, Public Health Canada, they must be conservative in their recommendations. They cannot go and get any new research that has been published last week and use it for public health because they need to give simple recommendations to a lot of people. So the simple results of a small study in a constrained laboratory with conditions for the experiment, they cannot use that, and they also have to give a clear message that everybody can understand. And it's extremely complicated because there are new research results every day, right? So I receive a daily email with 75 research papers that have been published each day on COVID, okay? And there are thousands of them. So the government agencies, they have to handpick what is guaranteed to work, and that creates problems. And these delays and this distrust in governments. And going back to the second wave, in history, it seems that people between the first and the second got relaxed, as we're seeing right now. They got frustrated, they got tired. What I'm vouching for is for the scientists to start building human behavior models, because the mathematical models are excellent and they are telling us what will happen with a lot of precision. The science on that has advanced a lot since this was invented in 1927. But human behavior, it's human behavior. So we are people and we're going to react in different ways. And we need to take this into consideration. So this kind of negation, lockdown frustration, will end up with things like Damien was talking about 2 seconds ago on demonstrations in London. And if you can imagine, the few people that are feeling frustrated, they go out on the streets to demonstrate. Imagine what we do every day. We relax a bit. We will get closer to our friend and talk to them face to face. And we will go to a restaurant, and it's cold, and we will go to the pub to have a pint. And those create, it's a risk issue, right? So we take risks, and some people are willing to take more risks, and the longer this takes, the more risk you're going to take because people are tired.
But Professor, one of the things, go ahead.
Sorry, I was going to say, I think we perhaps need to talk about the issue of the mathematical modeling and some of the distrust that people have in the science that's being endorsed by official bodies like the World Health Organization, like the governments of Canada and the United Kingdom and the United States. Here in the UK, notoriously, we had Professor Neil Ferguson of Imperial College, who did the mathematical modeling to estimate the death tolls from this pandemic. And it's his modeling that was used both to dictate the policy both in the UK and in the United States. And he predicted, on the basis of his model, that 500,000 people would die in the first wave of the COVID-19 pandemic.
That was for UK or worldwide?
That was for UK. He predicted for the UK, 500,000 people would die from the first wave of this pandemic. And we all quite dutifully went under lockdown and stayed in our homes. And then it sensationally emerged that Professor Neil Ferguson was inviting his mistress over from the other side of London to come over to his house for liaisons during the height of the lockdown. So, and this is the man who was on the basis of whose predictions our policies were developed here in the UK and in the United States as well. And there has sprung up a very vocal but seemingly small contingent of scientists who are apparently happy to deny the accepted knowledge on COVID-19. I know in the United States you have Professor John Ioannidis. In the United Kingdom, we have Professor Sunitra Gupta of Oxford University, who is a theoretical epidemiologist, as far as I understand. And they are denying the seriousness of this. And the people who you see going out on the streets and joining these protests, like this mass protest we had on Saturday afternoon, they're taking a lot from what they're hearing from these people. They're saying, well, there is no accepted view that this is as deadly as they say. Actually, the government are using this pandemic as a pretext to bring in quite totalitarian powers. In the UK, well beyond the people who were demonstrating on the streets on Saturday, there has sprung up some quite strong opposition politically and among civil rights groups to the powers that the government has given itself to combat this pandemic. The government passed a law back in March called the Coronavirus Act, which passed without a single day's debate in the House of Commons, which is the lower chamber of the British legislature, of the British Parliament. And effectively, it gives the government emergency powers which are unprecedented in any time in peacetime British history. And they have enacted hundreds of pieces of secondary legislation on the basis of this. You know, they've made it illegal for groups of more than 6 people to gather together on the pain of a very large fine. I think you can be fined up to £10,000. They've enacted laws saying that you must wear face masks on public transport. And they
complicate the job of Professor Wainer. Let me add to that people are referring to Swedish model, that without a whole lot of, this is also well established through many writings, that the dictators are taking advantage and totalitarianism is on the rise at the pretext of handling this. So rise of the government becoming more empowering itself with extraordinary, that has been discussed. But what about the Sweden model? Without reducing, is that a model which is being referred to is acceptable in your eyes, Professor Wainer?
The reality is that the Swedish model, it's a very controversial piece of information, and most deniers are, holding into that information. This is absolutely wrong. You cannot talk about the Swedish model. Okay, it's when you talk about the Swedish model, you cannot compare the Swedish population to the U.S. population or to the Brazilian population. What you have to do is you have to compare Sweden with Norway, Denmark, and Finland, and you have to see the number of people that died on each one of those countries. And it's 10 times in Sweden than in the neighboring countries. So here in Canada, there's normally a social distance that is it's way bigger than in many other parts of the world. And in Sweden, it's the same. And the epidemiologists there, they clearly stated that their society is already a society that is more distant from the social standpoint than many other places in the world. So it was, they attempted this herd immunity approach, but they had to stop it in the middle, recognizing that it was failing and there were too many people dying on this. And the risk is that if you let it happen and it happens, then you will need to go to a serious lockdown and the economy is going to stop way worse than if you do it in a controlled way. So the Swedish case, it cannot be really used as an example for anything. And now the studies in Imperial College, this is something that's extremely complicated for people to understand, and their negation process comes into the equation. Of course, somebody goes and do a mathematical computation about number of people that could die, okay? So we all know that these models, there are no perfect models, okay? These are all mathematical models, and they can all have failures, okay? What we say in the domain is that there is no perfect model. There are some models that are useful. So what happens is this. The Imperial College research could have been absolutely correct, but we will never know. Because as soon as you put measures in place, the results of the model change automatically. So what people see is not the hundreds of thousands of people dying by COVID. They are seeing what is the result of the potential of people dying by COVID affected by preventative measures. And they affect completely the behavior of the virus. The virus, so you get one person sick, and the mathematical model says that it will get 2 to 3 people sick if you don't do anything. So the models for this are very well known, and they will give you a minimum and a maximum threshold with a lot of variation. If you are lucky, you're going to be in the lower end. If you're unlucky, you're going to be in the higher end. But these models are known to work, and they will help you to predict and to take action. Now, it's a government's task to do this. It's not an easy task. And when the government actions result in something that do not match the science to perfection, well, people will use any excuse to do whatever they want to do, right? So they will say, no, nobody is dying until someone that's very close to you does, right? Because this is a numbers game, and you don't see the people, and it's a terrible disease that you won't get to say goodbye before they die.
We got just a couple of minutes, so let me squeeze in a few more questions for a brief answers. People are talking herd immunity as a desirable thing. Is this what scientists are looking for, a herd immunity? If yes, what is the cost of it?
So the herd immunity concept is I'm going to be crude on this. It's a fantasy. There's no herd immunity by itself. There will be a lot of people dying if you let it happen. And the math, it's very simple. Let's assume that the math is very wrong, and instead of getting 2 to 3 people, you get 1.5 people sick. This is an exponential behavior that it's well known, and you will get a lot of people sick. And even if the mortality rate is lower than expected, there will be a lot of people dying. To get herd immunity with this disease, you need around 60% of people that got the infection. And up to very recently, we didn't even know if you get sick, if you can get sick again. So you're going to say, well, we will do herd immunity, like, I don't know, the common cold. So we let the common cold get every people sick, and then you will get immunity, and you're good for the rest of the year with that common cold. But we don't know if it's coming back 3 months after that. There are cases of reincidence of the disease, and we really don't know why are people getting sick again. Everything changes every day. There are lots of studies going on, and with this uncertainty, we cannot play the game of herd immunity, because 60% of the world population, it's a lot of people. Now, how can we achieve herd immunity? There's only one way, which is through vaccination. So yes, we need herd immunity in a safe way. We will need 60% of the population vaccinated, and that would work, and that would stop the disease.
Let's talk about that vaccination for 1 minute. So do you have, when do you expect vaccination to be in place in UK or Canada? Do you have, a way of predicting when it will come? In America, people are very skeptic from the perspective that we have politics, we have presidential elections. So our president wants to have vaccine as soon as possible, and scientists are wary. Actually, states are saying we're going to do our own testing before we allow our people to be vaccinated. So what is the prediction in UK? Is a vaccine ready to be distributed, and distributed to how many people?
Well, vaccine trials have been going on in the UK for some months now, and actually, it's the Oxford University GlaxoSmithKline vaccine, which is our national vaccine. I know that in the United States, it's the Moderna vaccine, which is being backed by the government. So it seems that there are competing vaccines coming out from all over the world. Russia looks apparently like it's on its way to approving its second vaccine already, to some skepticism I've seen. But it's unclear when this vaccine is going to come, and when it does come, it's unclear how many people will feel comfortable taking it, given that it's been rushed through production so quickly. I think, I mean, from a lot of the people I've spoken to, and bearing in mind that I've spent a lot of my time with COVID skeptics over the past few days, their concern is that actually a vaccine, generally speaking, you would expect to take 5 to 10 years to develop for a completely new vaccine from scratch. This vaccine, politicians are talking about having one. Well, I mean, the Russian one was ready in 6 months. They're talking about having one ready by early next year in terms of the Oxford vaccine. And so I think there is considerable disquiet about whether having a vaccine rushed through that quickly is a good idea. And people are casting back to the last time a vaccine was rushed out very quickly, which I think was for swine flu, which was the Pandemrix vaccine, which caused a huge scandal here in Europe after it apparently caused some small number of young people who took the vaccine, who were vaccinated with it, to develop narcolepsy permanently for life. And I think a lot of money was paid out in damages. Many millions were paid out in damages to people in the UK and across Europe for that. In the United States, that vaccine was never distributed because there was a specific ingredient in it which the US the authorities in the United States weren't comfortable with. Well, so I do think that the vaccine is a difficult one.
Okay. So last question and brief answer, please, because we ran out of time with Professor Wainer. As people are saying that the second wave is going to be worse. First wave, people predicted how many people might die. And you mentioned that because of that alarm, a whole lot of people were careful and we were able to save a whole lot of life. We'll never know for sure, but those two things are fact which happened. Projection and extraordinary campaign to prevent, even for children. So what is your model is saying second wave is going to bring in terms of number of deaths around the world?
So the original numbers have not changed. During the summer, we have seen lots of studies, and they more or less validated the death rate, the communicability of the disease. So if we don't do our job, it's going to be bad. I don't have numbers right now for my simulations, but this is not going to look good. We have in Canada, in Ontario, we have a bubble of 10 people that we can visit, and those 10 people were extracted from a model that predicted that it was safe to meet up to 10 people. If we don't reduce the number of people that we meet with right now, it can grow exponentially, and we are already seeing the bad effects of this. Remember that the effect is not only that there will be a number of thousands of people dying. There are people that die that you don't see. So right now, there's only emergency surgery planned in some hospitals because of COVID cases. So you are not going to die of COVID, but you can die of heart attack or cancer because they are not going to be able to treat you because of so many people busy with COVID. We have to, number one, keep ventilation in our houses, reduce the indoor activity, exercise because it's important for your mind, your mental health, keep your distance, and reduce the number of people that you interact with in a person-to-person. Wear a mask if you're going to see someone.
Well, thank you so much, Professor Wainer and Damien Gayle from UK. Thank you so much for your contribution and your advice. And our producer, thank you so much for Shahidil Khan. You're watching Muslim Network TV on Galaxy 19 satellite, Amazon Fire TV, Apple TV, Roku, and our website, muslimnetwork.tv. peace. Be careful, stay healthy, and keep other people healthy. Peace and salam.